Good day. My pleasure to be here. Name is Mike Schilsky. I'm professor of medicine at Yale University, and I'm the director of Center for Excellence for Wilson Disease at Yale as well.
Affiliation or association with Arbormed?
I became interested and learned about some of the seminal work of Dr. Hans Zischke a number of years ago, and I've been following that. And I had the great pleasure of having the opportunity to now serve in an advisory capacity, both scientific with the aim of moving this towards clinical for this compound.
Please describe ARBM 101. What makes it differentiated therapy?
Well, this compound is really unique. First, it is a small molecule, and it's also non-immunogenic, and that means that you can give it and then not develop reaction from it, and you would predict a much better safety profile. But the unique aspect of this is, unlike any of the other available therapies now, this has the capacity to reduce the copper in the liver, to restore the balance of the copper and allow the mitochondria, which is the powerhouse where we generate all ATP, which is the cellular batteries that allow our cells to have the energy and function, and allow the restoration, and miraculously doesn't seem to pull copper out of other places where it's needed for metabolic function. Things like cytochrome enzymes, which allow us to process and move electrons along and develop other utilization of energy in the cells, doesn't seem to be impacted. By giving this compound, and it's been shown in the animal models, the liver injury that has occurred from copper can actually be abated tremendously, and you see a restoration, how the liver would look under a microscope when we take a piece out and process it and look at the cell structure. But also the mitochondria itself can be reversed, the production of energy. You can measure the production of free radicals in cells, and that also has been improved. The more recent data on this suggests not only do you reduce the copper, but you're actually sending it out by the pathway that naturally occurs for copper in the liver, that the excess goes out into bile, and that's exit from the body. So we have an understanding that you're taking the copper, not putting it back in the bloodstream where it may go to other organs, but putting it into the bile where it can then go out of the body, and that could be a safer way of removing copper, giving the chance for the liver to heal and restoring the balance in other organs as well.